Good morning and welcome to a special programme on the coronavirus crisis as the Prime Minister spent his first night in intensive care. Boris Johnson was diagnosed 11 days ago, but after his condition worsened yesterday afternoon, doctors moved him to intensive care at St Thomas's Hospital in Westminster. Michael Gove, who is now also self-isolating because a member of his family is displaying symptoms, said the Prime Minister has been given oxygen, but he is not on a ventilator, as Paul McNamara reports.
Good evening. The coronavirus is the biggest threat this country has faced for decades. And
this was already a national crisis. Another man in charge of handling it is too ill to do his job. On Sunday night, the Prime Minister was admitted to St Thomas's Hospital, a precautionary measure, said Downing Street, for tests. But last night he was moved to an intensive care unit where he remains. Mr Johnson has been administered oxygen, said a spokesman, but he has not been put on a ventilator. Still breathing for himself, 11 days since being diagnosed with coronavirus.
Alas, I still have one of the symptoms, a minor symptom of I still have a temperature, and so...
That was Friday. As late as yesterday afternoon, Downing Street was saying he was still running the government. Less than 2 hours later, he was in intensive care. An escalation as swift as it was dramatic, leading to the question, just who is in charge of the nation now?
The person who's running the country, following the plan that the Prime Minister has set out, is Dominic Raab, the Foreign Secretary. So at all the important meetings today, there'll be one quite shortly, which will assess how we deal with the coronavirus crisis. The person who will be asking the tough questions, reviewing the evidence and marshalling the other ministers and the civil servants and the advisers to make sure we're working as one team, that will be Dominic Raab.
That was 9 a.m. By 11, Mr Gove announced he was now self-isolating as a family member had began experiencing symptoms. Mr Raab led the COVID-19 meeting this morning. He'll be chairing meetings, but decisions will be made collectively by Cabinet, said Mr Gove. Decisions like when and how to lift the national lockdown. Decisions the new Labour leader has said he will support.
People are clearly anxious. I know the business of government will continue. I was in touch with the Foreign Secretary last night, and I want to say that the Labour Party will act in the national interest, and that's why I've offered to act constructively with the government and support them where that's the right thing to do and push them further where we need to do it.
President Trump sent his best wishes to the Prime Minister, calling Mr Johnson a good friend of his and of America.
Americans are all praying for his recovery. He's been a really good friend. He's been really something very special, strong, resolute, doesn't quit, doesn't give up.
He added he'd asked bosses of 2 drugs firms to help treat the PM.
We'll see if we can be of help. We've contacted all of Boris's doctors, and we'll see what is going to take place, but they are ready to go.
Support from other world leaders followed. The Canadian Prime Minister ending his message, "Hope to see you back in number 10 soon." That was echoed by President Macron of France, the First Ministers across the United Kingdom, and the person who did the job before him. "My thoughts and prayers are with Boris Johnson and his family," wrote Theresa May, adding, "This horrific virus does not discriminate." The Prime Minister isn't the only resident of Downing Street taken ill. At the weekend, his pregnant fiancée Carrie Symonds revealed she was recovering after a week in bed with the main symptoms of coronavirus, a disease that has shown, in this crisis, leaders are just as vulnerable as those they lead.
Well, our health and social care correspondent Victoria McDonald joins me now from St Thomas's Hospital, where the Prime Minister is being treated. Victoria, this all seemed to happen very suddenly last night. What has been made public about how the virus progressed in Boris Johnson's case?
Well, this is not uncommon, Krish, for somebody to be sick over a period of 5 to 10 days. They might even, in the middle of that, start to feel a bit better, and then suddenly they deteriorate. There is a million-dollar question, which is part of the research that's going on, is why does it affect some people worse than others? Now, let's take the 3 men, as it were, who were in the room, Professor Chris Whitty, the Chief Medical Officer, Matt Hancock, the Health Secretary, and the Prime Minister. Now, Matt Hancock and Professor Whitty were able to take their 7 days off and come back and get back to work. The Prime Minister has not been able to recover from it. We have been told he had a persistent fever. Then we were told he had a persistent fever and a cough, and that he was being taken into hospital. Then, of course, last night we were told it was into ICU. Now, there is no two ways about it. There is a degree of worry that if he has gone into ICU, it does mean that he is sicker than at first we were led to believe. One ICU consultant put it this way to me: pre-COVID days, you would put somebody into ICU if you were just a bit worried about it, but space is at a premium now, especially at a hospital like St. Thomas's. On the other hand, he is the Prime Minister and he is going to need the best possible care, and he is at an extremely good hospital. This is the hospital where the first COVID-19 patients came, and they have the world-famous infectious diseases unit.
There will be an update on the Prime Minister's specific condition in a couple of hours, but there are families all over the country with relatives and friends in similar circumstances. So what can you say about how the progress of the disease tends to go for patients in this situation?
Well, there are so many variables in this. Actually, can I just tell you that the Office for National Statistics has put out some new figures today for England and Wales, and it does show that actually our death toll is higher. We're not quite sure at this stage how much higher than the daily rate we get because of the time lag. But what people will be watching and waiting to know about Mr. Johnson is whether he has to go onto a ventilator, and there is a chance, because that's why they've moved him into ICU. We're told he's not on one yet, although that was last night's information. If he does go onto a ventilator, that will be to help him breathe, and he will be put into a coma, and then it will take about half an hour to intubate him with all the specialists around him. But it's not just the ventilation. There are other machines there in case of organ failure. There is a positive point, if you want to put it like that. Mr. Johnson is 55, so he's not in the over 65, over 70 risk category, as it were. He is also, although overweight, he admits this himself, he does a reasonable, apparently, amount of exercise. So it does give him a better chance. And then, as another doctor put it to me, this is a man who is resilient, who really knows how to fight. Look at how he does the election. Look at how he did the Brexit. So that will stand him in very good stead.
Victoria McDonald at St. Thomas's, thank you. Well, with the Prime Minister in hospital, the Foreign Secretary Dominic Raab is now in charge of the government's work as First Secretary of State. Our political editor, Gary Gibbon, joins us now from Westminster. What does that actually mean?
Well, it's interesting. In that interview that you heard a clip of in Paul's piece from Michael Gove, he was asked about Dominic Raab now being in charge, and he was very keen to sort of caveat that and say, well, there are all these committees that work on COVID and they're run by different people. And Dominic Raab is in charge of implementing the Prime Minister's plan, he said. And so he does not have unfettered authority. The Prime Minister is the Prime Minister until such time as they are not in office, whether removed by illness, incapacity, or in rare circumstances, the Queen removing someone from office. And so the authority still rests with the Prime Minister, and Dominic Raab has authority to implement the Prime Minister's plan. If he were to turn around and say he wanted to do something drastically different, I think you'd find the Cabinet sort of menacing towards him. And I think Michael Gove's answers there diplomatically nosed towards that. He does not have unfettered authority, and it is not absolutely clear that it would be him that would step into the breach if the Prime Minister was incapacitated, couldn't continue in his role for whatever reason. It would be the Cabinet potentially who would decide, perhaps on an interim leader, pending a full leadership election in the future. And in the past, they've sometimes picked on someone who wouldn't be a candidate in a leadership election, someone who would, as it were, rise above the political melee and just implement something that the Cabinet wanted, rather than having a strong particular opinion themselves or a wish to hold that office.
Gary Gibbon in Westminster. Well, joining me now is the former Conservative Party leader, Duncan Smith, who was chairman of Boris Johnson's leadership campaign. Duncan Smith, Sir Ian now, of course I should say. This is first and foremost a personal crisis, and all of the Prime Minister's friends and family must be very worried about it.
Can't see. I can't hear anything.
Can you? I'm sorry. We obviously have a problem with the line to Sir Ian at the moment. We will try and re-establish that line, but we'll move on for now and try and come back to it. Well, intensive care units are designed to provide critical support for patients who are extremely ill. The Prime Minister was admitted last night as a precaution, and so that he could be close to a ventilator, which might be needed if he continues to have breathing difficulties. Fatima Manji now reports.
Just 5 days ago, the Prime Minister joined in with the nationwide clapping for NHS workers. Now his own care is in their hands. So what happens inside intensive care? Coronavirus patients who seem to be deteriorating or are in danger of doing so are transferred to the unit. One of the first measures used is a continuous positive airway pressure mask, or CPAP, to supply oxygen. This is a demonstration.
If they come to intensive care, the first thing that will happen is they will be assessed in detail. That would mean taking blood samples. It would mean probably a chest X-ray. It would mean doing ECG of the heart, maybe even an echocardiogram, and then seeing if with the CPAP mask whether oxygen levels were okay and whether they were feeling well or not. If we felt that wasn't working, we would then have to put them to sleep in order that we can put a tube into their windpipe and attach them to a ventilator. So that would be the first phase, and then we would have to see how they fare with the ventilator.
Cabinet Minister Michael Gove says the Prime Minister is not currently on a ventilator. Many COVID-19 patients in intensive care do have to progress to a ventilator, though. This takes away the work of breathing for them and can also prevent parts of a lung from collapsing. One of the biggest difficulties for medical teams is that coronavirus patients don't react in the same way as someone with pneumonia on a ventilator normally would.
They don't behave in the way we're used to, and it may well be they develop what we call multi-organ failure, where their kidneys aren't working. We have to add that to the equation. They don't ventilate as easily as some other patients, and we end up having to put them on their front, which is quite a difficult thing to do, needs lots of manpower, and ventilate them there for about 12 hours or 6, and then put them back on their backs and so on. And that requires 6 people just literally to move them. So you can see that intensive care for these patients needs not only, we're dealing with a lot of patients, but each patient needs a lot of manpower as well as equipment.
At 55 years old, Boris Johnson is relatively young and healthy. He should stand a fighting chance. But this is a new disease, and much is unknown about the prognosis for patients.
Well, when we talked to the Italians when they were in their peak, and this was before we started getting many cases here, it seemed it was the elderly population. I remember looking at some figures. None of the deaths there initially were less than 55, but then and people with diabetes and hypertension, all these things seem to play a role. But as you know, in the last few weeks, we've seen very young people, even children, that have succumbed to the virus.
Mr. Johnson is the first known world leader battling the disease in a serious condition, but of course many people are suffering around the globe. Johns Hopkins University estimates 1.3 million people have been confirmed infected. Japan is the latest country to declare a state of emergency. But there is some reason to hope. Cases seem to be dropping in Italy, while China, the first country to go into lockdown, has reported no new deaths in the last 24 hours.
Well, let's try again now to speak to the former Conservative leader, Sir Ian Duncan Smith. Sir Ian, I hope you can hear me.
I can.
This is first and foremost a personal crisis for Boris Johnson, and his family and friends will be very worried.
Yes, I mean, I'm a friend of his. Many of my colleagues are, and of course our hearts are with him and his family. Kerry, of course, is pregnant, his fiancée, and he's got children and brothers and sisters, etc. So they'll all be worrying about this, and my prayers are with him. He'll battle this through, but I do feel he will get through this.
Now, most of us have got friends who've had symptoms in some form, and, you know, we've all said to them, take it easy, don't do anything, stop work. And I think it was Michael Gove's wife, Sarah Vine, who pointed out, you know, he's worked throughout his infection, and this is what's happened. I mean, were you saying to him as well, look, stop what you're doing and take it easy, even though you're the Prime Minister?
Well, let's be very clear. He didn't carry on at the same level. He delegated a lot of decision-making, and he took part in what he would call the most important elements of that. So he wasn't working at the same pace, wasn't charging around the place. So it sort of slightly overcooked this. The idea is he's Prime Minister and he knows his ultimate duty is to make those decisions that come off a series of discussions with Cabinet. And I think, therefore, up until the moment when he couldn't do it, it was right for him to say, I am still in charge. And he is in charge because he heads up the government. Now he's handed over to Dominic Raab. And where I disagree with some of the comments being made already, it is very clear. Dominic Raab is the first secretary. That is a statutory position. That means he is the number 2 to the Prime Minister in government. And that means, therefore, when push comes to shove, he will head the government whilst the Prime Minister is incapable of making decisions or being in charge, as it were. And that will be the case. There's not a speculation about this. That's where it is until something else changes. And the Cabinet will unite around him. And this is a collegiate process, so he will head that up, but he has the authority.
So if there were to be, you know, perish the thought, some other terrible crisis or attack or something of national security proportions, you know, what would happen now? Is the Prime Minister right now still in charge as long as he's conscious? Or is that already, does that already rest with Dominic Raab?
No, until the Prime Minister rescinds that, he has made it very clear that Dominic Raab is now taking those decisions. Unless he pulls back a decision to himself, it now remains invested in Dominic Raab. The Cabinet Secretary will be with Dominic Raab. He is de facto standing in for the Prime Minister. He is his deputy. It's a statutory position as First Secretary, and the Prime Minister has made it clear he's handing over these powers to be used as required and as far as is necessary. That means he hopes he'll be back fairly shortly, and I am certainly with that. But in the meantime, there is no question Dominic Raab is now the Deputy Prime Minister, taking whatever decisions are necessary to be taken by the Prime Minister.
There are other ministers and cabinet ministers who've had the virus and who are now self-isolating and so may well get it. Do you think this should change their approach? Should they all stop work similarly when they have it and concentrate on recovery?
No, I think the key point here is until it becomes impossible and clear that you can't make clear decisions, you are unable to think clearly and be of clear mind, I think it is your duty to continue to try and do what you can at a reduced level, perhaps. But if you imagine this for a second, had the Prime Minister said, I've come down with this, therefore I'm not going to be Prime Minister anymore, most people would have quite rightly said, but hang on a second, you know, you're still able to communicate. So I think there's a balance. This is not a science. We're dealing here, by the way, with an attack by a virus which causes huge damage, but we have no idea. Some people recover quickly, some people don't.
Surian.
So we're feeling our way forward, and therefore there's no absolutes about this at all.
Surian, thank you very much for your time. Well, let's talk now to Catherine Hadden from the Institute of Government, who's an expert in the way government and Whitehall function. What will be the impact of this and the way the government is now functioning?
Well, I mean, to some extent, what Ian Duncan Smith was just saying there is the reality. Dominic Raab has been given authority by the Prime Minister, by Boris Johnson, to take over, you know, the majority of his duties, whether that's sort of handling the paperwork that comes his way, the daily red boxes, all sorts of decisions and briefings in that, chairing meetings, chairing the daily ministerial meetings where they're dealing with coronavirus. So some of that will just carry on in the way that it has been operating before Boris Johnson went into hospital. You have a number of different cabinet committees headed not only by now Dominic Raab, but also by Michael Gove, by the Chancellor Rishi Sunak, by the Health Secretary Matt Hancock, and those will all be coordinating what's going on. And it's cabinet government that then, at times like this, really comes together. What it means is that the cabinet needs to work together to decide their collective position, and Dominic Raab's role is very much in coordinating that, but also gripping the machine and making sure that number 10 is operating, and then just carrying out a lot of those practical duties. But from a constitutional point of view, it's the cabinet where power is invested, and it is entirely possible for another minister to take over.
OK. I mean, every organisation in the country, perhaps in the world, is hampered right now with people off sick, people self-isolating. Government must be hampered as well, and it's got a massive job not just dealing with the immediate crisis, but the financial impact and everything else.
Yeah, and we know that there are other people in number 10 who've also had to self-isolate. You know, the Prime Minister's Chief of Staff is also protecting himself at home. Many of them will be working remotely, but that still means that they've not got as many people into number 10, and probably sensibly so, given the need to isolate yourselves. And obviously, we're seeing so many people from the top of government who are falling victim to this virus. They're also, though, bringing in other people. They've brought in extra people into number 10 to try and boost their capacity to get those extra skills in. They've brought other people into the Cabinet Office as well to help coordinate on all of this and support the civil servants who are doing this. So they're making sure that they've got extra people in place, and they're, like every business, also having to figure out different ways of operating. Before
Catherine Hadden, thank you very much indeed.
Thank you.
Thank you. Well, as the Prime Minister remains in intensive care, what support will he be receiving? Joining me now is Celaya Hassan, who's an A&E doctor at Bangor Hospital in North Wales. First of all, can you just explain what are the decisions doctors make, or what are the things that... why do you move somebody from an A&E ward into intensive care?
So currently I'm in London. I'm not working in Bangor at the moment, but again, speaking broadly and not directly to the Prime Minister's case, when we receive patients within the emergency department, we monitor them to see how stable they are. We look at parameters like their breathing, like their oxygen levels. What we're seeing with COVID-19 patients is that there's a problem with oxygenation. So people aren't able to maintain their oxygen saturation levels at an optimum level. There are, as already have been discussed, measures that can be taken. So we will try the simple things first. Oxygen, can we supplement oxygen? Can we do that by putting on a mask on a face or nasal cannulas, giving a little bit more than the 21% of oxygen that's in the air? If that isn't working, and we're looking at their respiratory rate as well as their oxygen, if that's increased and if that's off, what else do we need to do? Continuous positive airway pressure. That's a bit like, let me just describe that. That's a bit like when you're in a fast moving car and you put your head out the window and you feel all that air against your face. That's what CPAP feels like. I've used it a lot. For my patients, it does turn people around. However, when CPAP is failing to support breathing sufficiently, you may well then have to speak to your ITU colleagues to come and review and consider moving on to an intensive care unit.
And just explain what intubation and ventilation is. And you're unconscious, are you?
Yes. So when it gets to the point where the patient is far too tired, and we're talking about patients tiring from the active breathing. Breathing is something that we do naturally. We don't even notice it. You notice it when you become unwell, when you can't complete a whole sentence without having to stop for breath, or you're using your muscles. So intubation happens when the patient, it's decided that the patient is actually tiring from breathing. And at that point, breathing has to be taken over. We have to support the breathing. And we need to do that before the patient loses consciousness, before they threaten their own airway by losing consciousness, or when they are threatening to get some organ damage as a result. So
Celaya, I'm sorry to interrupt you, but we're out of time. But thank you very much indeed for that explanation. Well, as the Prime Minister remains in hospital this afternoon, we'll have the latest on his condition and the crisis more broadly when we're back at 12:30 and again at 7 o'clock. Until then, that's Channel 4 News.